Wandel, Dean Sandeep Kaushalji, and we also have our secretary, Shri Vipin Gupta ji. A very good morning to all of you. At the outset, I would like to thank the management of Dayanand Medical College and Hospital for inviting me to speak here. It is a great honor and privilege to speak at the graduation ceremony of this institution, an iconic institution named after one of India's greatest sons, one of the greatest social reformers and makers of modern India. As we all know, DMC is not only the oldest medical colleges in North India, going back 90 years, but also amongst the best. Set up in 1934 by visionary Dr. Banarsi Das Soni, a captain in Indian Medical Service, it has grown from its modest beginnings. Started as Arya Medical School in a rented building. We saw the pictures when there was the presentation by the principal in civil lines into what it is today, a premier medical college and hospital of India. The Dayanand Medical College and Hospital today is providing graduate, postgraduate and super specialty medical courses in almost all disciplines. And it takes a lot to provide high quality and advanced medical care to lakhs of patients coming from all over North India and even beyond. It has a full-fledged heart institute, a cancer center with state-of-art facilities and a research and development center which is very, very important. And today I also got to see the liver transplant center, which was one of its kind, a great center. DMC was at the forefront at the fight against COVID with its large indoor and ICU facilities. The DMCH management serves kudos for their untiring efforts over the years to continuously enlarge, expand and modernize the DMCH and maintain and improve its standing as one of the India's premier medical colleges and hospitals. You can all be justifiably proud of having secured admission in such a fine institution and for reaching today a remarkable personal milestone of successfully graduating as medical doctors. We all know how difficult it is to secure admission in a medical college and particularly a top-notch college like this. So obviously you are amongst the best and the brightest. But that was only the first step. Medical education is grueling, demanding time, commitment and sacrifices of personal comforts, leisure of highest order. So I would like to congratulate all of you for your accomplishments, for having successfully mastered all your clinical and non-clinical courses, theory and practicals, acquiring privilege of treating patients. I congratulate all the students who are getting their degrees today and the award winners for their hard work. I would also like to congratulate the parents and family members for their support, the sacrifices they must have made to help realize the dreams and aspirations of these young men and women. And I would like to congratulate the faculty for the devotion, for imparting not only knowledge, but also the art of medicine, art of diagnosis, nuances and ethics of medical profession. Friends, this marks the culmination of one chapter of your life and the beginning of a new, exciting one. You will be now putting your learnings into practice in the service of humanity. Medicine is not just another job or a profession. It is a higher calling. It's not a 9-to-5 job. The demands on your time will be enormous. You will be required to be available 24/7, 365 days in a year. Doctors often have to work at great personal risk, as we saw during COVID, but then it has its rewards. doctors never retire. You may retire from a job, but you can continue to work and serve the society, and that would be lifelong. The doctors are respected, even worshipped, next only to God, because they can give you a new lease of life. As Hippocrates said, healing is a matter of time, but it's sometimes also a matter of opportunity. And that opportunity depends to a large degree on a person's circumstances. Opportunity is not equal for all individuals. Access and affordability are more serious public health issues and challenges. These involve policy decisions that are not always under your control or domain. However, you are not just physicians or surgeons or radiologists treating the patients that come to you. You are also leaders of society. My appeal to you would be to spare a thought for those who are not so fortunate to have access to good medical care and work to improve their access. For all sections of society and for all regions, far-flung areas, poor and disadvantaged. As Dr. Paul Farmer, the legendary physician and humanitarian, said, the idea that some lives matter less is the root of what is wrong in the world. I would like to request you to strive to make every life matter. There are many things that you can do to improve access and affordability of medical care. One, you can prescribe generic medicines as far as possible. I'm told the price differential between the exact same formulations under different brand names can be as much as 10 times. The generic medicine stores, Jan Aushadhi Kendras, set up by Government of India, are helping the poor and the middle class. They are saving hundreds of crores of rupees every year. Second, you can use and promote technology. I think this was said by Mr. Manjar also earlier, and it is very, very important. Telemedicine, for example, can be a game changer for a country, especially for our people who are in different areas where we can't reach. It is not a solution in all situations, but in many cases, it can bring expert advice and consultation home to patients, saving time and money. AI and data analytics can be used for predictive diagnosis. Third, you can use your influence and standing as community leaders, combined with the outreach through social and other media to promote preventive care, well-being, and healthy lifestyles. We were discussing today earlier also that how the lifestyles today are causing many of the diseases. So to obviate the need for expensive treatments, diagnostics, and procedures, we need to work in unison. Fourth, you can set aside a part of your time, your practice as individual doctors or in your hospitals to provide free, subsidized care to the needy. You will be emulating the ideas of Dayanand Saraswati, the Arya Samaj, and of course your great institution, which I am told has policies designed to help the needy patients with expensive treatments. It may be a transplant required, or it may be an evening OPD. Outreach programs to address needs of society are a necessity now. And by doing so, you would be giving back to the society, which all of us must do in our respective areas of work, wherever we are. Medicine is a science that is continuously evolving with advances in diagnostics, treatment methodologies, and holistic patient care. I hardly need to emphasize the importance of continuous lifelong learning and interdisciplinary approach, which is very, very important nowadays. So not only adopting good practices from other systems of medicine and well-being like Ayush, Ayurveda, and yoga in particular. We should not work in silos. One more thing I would like to say before I conclude. I'm sure many of you would have watched the American drama series House. So I would recommend that you watch. If you haven't, I can see some people smiling, so they have. But those who haven't, please watch at least a few episodes. The character of Dr. Gregory House, played by Hugh Laurie. He's a cranky, eccentric doctor, but he's obsessed with getting to the root cause of his patients. The medical problems are, sometimes very complex, and what they seem and what they actually are different. It is, of course, fiction and over-dramatized, but central messages don't rule out anything. Don't only think of the obvious cause. The second striking thing in this series which I found was the practice of intense discussion among the team of doctors. It is this sort of passion, the spirit of inquiry, and multidisciplinary team consultation and effort we should all strive for. Each patient is unique with their own unique characteristics, habits, history, secrets, and lies. As Sir William Osler, the father of modern medicine, famously said, the good physician treats the disease, the great physician treats the patient who has the disease. But today is not the time for homilies. Today is the time for jubilation, celebration, and letting go. So have fun, all the graduating students, their families, and faculty. Greatest congratulations to all of you. Thank you.
Thank you very much, ma'am. Now I request the principal to declare the convocation closed.
I declare the convocation